Well, hello, everyone, and thank you for joining us today. This is Paige Nuez, Director of Family Empowerment at rettsyndrome.org. Very happy to be with you. I'm here by my phone, and I hope that you are all seeing us and hearing us well from your devices at home. We're so grateful for you joining us today. We're beginning to hear talk about starting our new normal, potential reentry back to work. We don't think that this is going to apply to our kiddos anytime soon. Hopefully your home health care might be able to begin again with standards for PPE and things that you can start getting some help in your home again. But if that doesn't happen anytime soon, we are so happy to bring you our fourth session with Dr. Meir Lotan from Israel to talk about some ways to keep our kids active and moving and engaged while at home. We know that it's difficult being at home without your regular equipment, without your regular support systems, and we know that you're getting lots of advice on how to have continuity with your jobs, with your healthcare, with education, hopefully. And we here at rettsyndrome.org are just trying to do our part in bringing you some advice on things that are relevant and specific to you and your child with Rett syndrome. So we're very glad to be with you live. We hope that this session will inspire all of you to start some creative possibilities at home. We are going to check in with two of our wonderful US families who have adults with Rett syndrome and see how they're doing. And Dr. Meir Lotan is going to get started now. Let's see. Yeah, Meir, are you with us?
Yeah, okay.
Okay, there we go. So in the interest of time, I'm going to go ahead and let you get started, and then I'll come back to you at the end. Oh, by the way, if you're on Facebook Live, if you have any questions for Dr. Lotan as he goes throughout his presentation, just type them into the comments field, and we'll address them when we get to the end. Okay, thanks, Meir. Take it away.
Okay, so hi, everyone, and thank you for joining us again for the fourth meeting of activities you can do with your child with Rett syndrome and in Corona lockdown. And today we're, as Paige said, we're going to focus on two adults with Rett syndrome, but and these are the girls that we're going to talk about, Heather, Keilly, and Siera. But Heather will not be joining us today. She will be joining us on the 30th of the month in 2 weeks' time, because we are actually going to do in 2 weeks' time. We're trying to do a live program building session. So we're going to present Heather today, but also 2 weeks from now, and then her parents are going to talk about their difficulties, and then we will ask you as audience, as spectators, as people who know Rett syndrome, to suggest what can be done, what Heather parents can do when they are with her. And we're going to suggest your suggestions to Heather parents, and they will respond, and then gradually we will build a program for Heather that her parents can do when they are at home with her. So Heather is 41 years old. She's total wheelchair dependency. She has no manual abilities, and according to her parents, no communication. But she vocalizes, and she has things that she wants to say. We heard her, and what they have at home is soft hand splints, a ceiling-mounted lift, and a wheelchair. The thing is that when we visited Heather at home, I suggested the family to do some things that Paige thought that it would be interesting for other people to hear, and this is why we're starting with Heather, not with her specifically, but to talk about the possibility of using your ceiling lift in kind of a different way, like a therapy device. So Heather's physical therapy goal, keep her hands and arm flexible. And what's the most difficult physical activity at home now is she's very tight. She has very tight arms and legs. It's very difficult to dress her. Her neck muscles are very tight, and she is leaning to the right all the time, and dressing her is very difficult. As I started saying, some of the girls with Rett syndrome have ceiling lift at home. So actually, you can use the ceiling lift as a sling. Now, the word sling, I found out lately, is, I'm a physiotherapist. For me, a sling is something that I use, as you can see in this picture. It's something that I use when people are coming to have therapy, and if I want their different body parts to be supported, then I use the sling. It turns out that sling is something that you put when you have a broken arm or shoulder. It's something that sling is also the hammock of the lift is also called sling. And also, if you have a weapon, the the belt that you have to hold the weapon on your shoulder is also called a sling. So you'll find a lot of slings on the internet. But what you can do with the lift is actually, this is what you do when you're using the sling. You can move one body part in only one direction, okay? So this is actually a good thing, because if the person with Rett syndrome is inside the sling, she feels supported. Many of our girls with Rett syndrome have a fear of movement. So if they move too fast or unexpected ways, or uh, then they get all tensed up. This is actually what happens with Heather when you move her. So when you use the sling, let's say, as you can see in this picture, you can actually use the sling for one organ at a time, but you can also use it for the whole body. So if we take the lift of the ceiling, if we take the sling of the ceiling lift, and we can start moving the person with Rett syndrome very slowly at the beginning in linear movement from forward and backward, using very slow and relaxing music, then the child can relax, and then gradually we can start doing all kinds of movement from side to side. We can hold the legs or the shoulders and actually do movement that that our girls with Rett syndrome can only feel when they are doing hydrotherapy, floating on the water, and the hydrotherapist is moving their body. So therefore, this is a way to get the person with Rett syndrome to actually accept movement as a good thing, because the sling itself, the hammock of the lift, is actually holding the person, his whole body. It feels very safe, but at the same time, you can have movement in this position. So this is something that you can do for the whole body. Okay, move the person forward and backwards, but you can also use the smaller slings for specific organs. And we have this video that I have taken. Sorry, just a minute. Okay, so okay, and here you have a movie that you can find. There's a few of them that you can find. But this is one of the most
action of mineral waters, paloids, gases contained in some of the spas. Dry massage.
do a specific exercise.
Use a variety of techniques for therapeutic purposes. Kinesiotherapy, a treatment based on movement. The goal of rehabilitation is to restore lost motor functions as soon as possible, increasing strength of gluteal muscle. On the seat beside there are performed resistance exercises of lower limbs.
You can use the slings to move the arms or the legs. You can use weights like they do here, or you can use rubber bands as resistance or as pullers. But you can actually use the sitting hoist to get different exercises. So you can have your child with Rett syndrome lie on her back and move the knees, move the as we mentioned, you can move the child and her whole body. You can attach a sling to the head and get the head relaxed, floating in the air if you want, and relax the muscles of the neck. And this is one of the problems that was reported by Heather's parents. Now, the next thing to ask is, okay, so we have, this is the YouTube that I just showed you, but the next question that we might ask is, how can I replace this big sling with small ones? Because the slings that you use at home to lift the whole body are very big. It's very difficult to use them. So one possibility is to buy them, okay? And here you have one place where I found that you can buy those small slings, okay? Another way, as you can see here, is to use belts that you have at home and get specific ways of lifting one of the organs, okay? A leg or a hand. Another way is to make one, and this is what I found. I found, again, YouTube video that showing you how to make your own. It actually tells you how to make a hammock, but it doesn't really matter because we're in the same way that this guy is showing how to make a hammock. You can actually make a small sling with a pillowcase. So you have this video on YouTube. Again, I have the link on the presentation, so you can all look specifically on how to make. We're not going to see the whole video. I just wanted to show you that you can find it, and then you can see how to make a hammock by yourself. Now, another way is to take, let's say, an old basket, and then if you just cut the sides, okay, and then actually what you have is a kind of a sling that you can put together on the lift, and then you can hold one arm or one leg and do some movements with your child with Rett syndrome. I thought of household appliances, household things that you can use to make small slings from, and I thought about aprons and also about overalls. If you just tie this one side to the lift, and then if you use some ropes from this side, then, and this is another way to have homemade slings if you don't have a way to buy them, or you want to do it very fast and you don't want to wait until what you bought is going to come through the door. So as I said, we will meet Heather and others in 2 weeks' time and plan together with you a therapeutic program for her through our last Zoom meeting at the 30th of April. So now we're going to meet Keilly and her family. So let me introduce Keilly before we go over and see what they do with Keilly on a daily basis. So Keilly is 20 years old. She can walk independently, and sometimes she needs assistance in balance. She's very content, but she falls asleep very easily. They have at home a Yogi Bow beanbag, chair, and some PD equipment. The current
Okay, so one of the things that I wanted to accomplish with this youth adventure training program is to teach kids simple thing, and it makes you feel much more.
Sorry. So the current physical therapy goes with Keilly is stairs, and she has all kinds of exercises that we're going to view in a minute on that she does with her mother, Arian. And the most difficult physical activity at home right now is going up and down the stairs and walking at certain times of the day because Keilly gets stuck. Okay. And movement activities that are difficult now are dressing and going up and down the stairs.
Okay, Meir, we're seeing your YouTube screen. I don't know if you were intending to show slides. There we go. There's your camera.
Thank you. I'm trying to move.
There we go. We're back on PowerPoint. Okay.
Yeah, but I'm trying to show. Okay. So what Keilly does every day with her mom, before we're going to see actually some of the exercises that they do together, is she cooks with her mom. They're doing exercise, walking up and down the stairs. They're doing all kinds of exercise for the hands and the back. High kneeling that we're going to see. They're doing transitions from high kneeling to stance position. Side sitting is another exercise that is difficult for Keilly, and they do it together every day. Keilly also have Zoom meeting with friends, and to maintain her abilities to finger feed, they make sure that she has daily opportunities for finger feeding. So I guess now we're going to go and see Keilly and her mom.
Oh shit, we lost it. It was on Facebook. How did you log on?
Through the link in the email.
Oh, we're having some difficulty here, at least on my side, because I don't see. There we go. Hi, Keilly.
Good morning.
Good morning.
Or good evening.
Yeah,
Can you hear me?
we can hear you, yes.
I can hear you. Okay. So I have, as you can see, I have Keilly sitting on the floor right now with support with her exercise ball. And with a little bit of, sometimes she's helpful. Put her into a side sit. Her right side can be easier and less challenging for her. So I'll get her legs over to the side before I take her ball away. It's from your arm, out in your hand. There you go. And I'll just move the ball out. So So she sits pretty well on this side. She has more flexibility in her right hip. And so we just try to get her to bring her left hip down a little bit for some stretching while she's also self-supporting. Here you go, kiddo. Here we go. So we usually sit in this position for, I try to go to 30 seconds to about a minute if she'll sustain. And if she gets tired, she'll let me know. She'll push her legs right out, and then we'll move over to the other side. Good job, kid. Nice looking. Good job.
Very nice, Keilly.
That's great. You're doing a good job.
Yeah.
So the other side is just a bit more challenging. We're gonna transition over, kiddo. Move over. Yep. Good job. Yourself up. Over. Good girl. So then I help facilitate a little bit. She might fight me. You can do it. You can do it. Here we go. Usually once I get one, then the other one will follow. Might need to move around her. Good job. So this one's a little harder. She doesn't have as much strength on her left arm. So I'll use the couch, bring her arm up. This also provides a nice little bit of a stretch on the left side of her body. And then it's more easy for her to hold herself up in this position. And then I give her something sweet to look at, because then she can hold the position just a bit longer. So I have one of her favorite videos playing. Here you go.
Very good, Keilly.
Good job. This is actually a really great position for me to have her in, and she can hold it for a while. The couch with the cushion flipped up provides her great support so she doesn't fatigue too easily. Though when she does start to get a little tired, she'll pop her legs out and let me know clearly that that's is getting difficult for her and tiring for her. Are you doing a good job? Once she's in this transition, in this position rather, it gets easier for me to then transition her to a tall kneel. And I have the mat down so it's not so hard on her knees. Tall kneel. Can I have your other hand? Okay. You're gonna come up. Ready? Come up. Good girl. I'm just gonna straighten her out onto the mat a little bit so that her knees don't, oops, she's already trying to go to the half kneel. Okay, there we go. Good job, hold on. I got you. Got you. I might pop her knees out just a little far apart so she feels stable. There you go, you got it.
Wow, Keilly.
And I stay right in front of her with my hands out so that she feels confident that, you know, she can reach for me like that. Good job. And then I might wiggle out from under her a little so she can exercise your strength. Doing it all by yourself. Doing it all by yourself. You look great. I'm right here. Good job. Good job. So then from here, I would go to a half kneel, and I'll let her decide if I rock her back and forth and see which knee she feels like bringing out. Typically, it's her right knee. Oh, but we're going to go left today. Yes, no? Changing your mind? All right, we'll come to half kneel. Bring it up. That's it, girl. And then all the way up.
Wow. That was
She does
fast.
she does that pretty quickly. And then we're standing.
Very nice.
Okay. There we go. You want to go sit? How about I get the ball? I'm gonna sit on the ball. Have my assistant roll the ball to me. There we go. Okay, we're gonna sit on the ball, okay? So she feels it on the back of her legs, which means she can sit. There we go. And with the ball, I just might, hold her legs a little bit and gently rock her back and forth. It's great for her core to build up that strength. And we do this. And then the side to side a little bit too. Not too much, because I don't want her ever to feel unsafe. And I have a good grip on her, so she's not going to go anywhere. Yeah, girl.
Very nice.
There you go. You're doing great. That's it. She likes this exercise. I think that's probably because it's easiest on her.
Okay, so.
Good job. And stay. You want to stand up. So those are a few of the things that we do at home.
Okay, thank you, Keilly. Thank you, Ariane, for sharing.
Thank you.
Wow. Bye.
You stand up.
So some suggestions. Some suggestions that addition to Keilly's program that I suggested were, for instance, as you can see, Keilly is doing a very nice job of doing high kneeling, and maybe it's time to add a small cushion or a mattress under her knees, and then the high kneeling becomes more challenging. So this is one exercise that they can do a little different. Putting an air cushion under the knees is another way of challenging the same exercise. Another thing that I suggested, because as I presented Keilly, we talked about the fact that it's very hard for them to, it's very hard to Keilly to walk along, and sometimes she gets stuck. So I suggested to them that maybe they have, like, she has 2 siblings, so there are 5 people at home. So if everyone would invest like 15 minutes of dancing with Keilly, then actually she would be dancing for an hour a day. And this is good for movement. It's good for the fact that she gets stuck, and it's also good for physical fitness. Another problem presented by Keilly's mother, we didn't talk about it until now, but she was, when we met earlier this week, she was talking about the fact that Keilly has tight shoulders, and she's walking around the house with her shoulders elevated all the time. So I suggested a few suggestions for her. I mean, I'm showing you all of them. Ariane chose one of them as the best option, but I'm showing you all of them because you can choose for yourself. If your child is walking around the house with elevated shoulders and tight shoulders, then maybe you can choose one of the above, one of the selected possibilities. For instance, if you have a massage bed, then you can put the child on the massage bed, and here you can see you extend the hips, you extend the shoulders, and the head could be tucked in the hole of the massage bed, and then you can do some massage to your child with Rett syndrome, and she's relaxing. She can watch a video on the tablet or a computer here at the hole, and she gets massage and she gets her body straightened up. So this is one way of dealing with it. Another way of dealing with these tight shoulders is to have wrist weights on the hands. This is something that is actually done by Siera, last participant in this meeting, I wouldn't try and recommend it to somebody I'm not there to supervise, because if you're doing it, if you put if the weights are too don't weigh enough, then she could actually fight the weights and then actually get her muscles strengthened instead of relaxed. So this is something that you have to be, as a physiotherapist, I would have to be there to suggest this kind of solution. Another solution is to wear a weight vest. As you can see this girl in this picture, this is also giving more sensory information to girls with Rett syndrome, and we know that they don't get the processing of the proprioceptive system is not as good in Rett syndrome. So this is actually gives the child more information, maybe relaxes her more. Another option is to put the child with Rett syndrome on her back and then start rocking her knees back and forth. And this rocking movement is quite relaxing. And you can do like option 4A, which means that the child is on her back in supine position, and you can put something on her shoulders like a hot pack. You have those things that you put in the microwave. You have the chemical things that you can put on the neck, and also there are all kinds of machines that you can that vibrate and you can put behind at the back of the neck while she's in this position. So all these options are if you have a child with tight shoulders. Another problem by his mother is the fact that she gets stuck, and I suggested to her that she might use a treadmill at home, and this is something that will also, it's good for physical fitness. It's good if the weather is not enabling for you to get out or if you're under lockdown, and you can do some walking around the house and it gets you moving. So this is Keilly and her program, and as you can see, Keilly has a very interesting and rich program. But now we're going to see Siera, and I think you will be amazed with the program that Siera is doing at home, because Siera is also able to walk independently, and she uses SMOs on her ankles. The equipment that they have at home, they have two adaptive bicycles. In one of them, Siera rides and her mother walks beside her, and the other one is a tandem bike that Siera is sitting behind her mother, and they both ride the bike together. Her physical therapy goals are increasing spontaneous walking distance and weight bearing, shifting into the left hip, as Siera has a problem in the left hip, and this is something that was congenital. I mean, she has a displaced hip from birth, so she has a problem putting her weight on the left leg. Okay, the most difficult physical activity at that point, as her mother said, is she has those dystonic episodes in the shower, and the most difficult movement activity causing stress to your body is those dystonia episodes in the shower. So we're going to discuss it later. Siera's regular program before the lockdown was that she was walking on a Locomat. Locomat is a kind of machine that you can see in this picture. It takes your weight away. So she's walking on the Locomat with 30% of her body taken by the machine. So in this position, she can actually walk more symmetrically and put more weight, put even weights on both left and right hips. As I've said before, they have tandem bike and they're riding it in the summer. This is Siera on her bike. Every day they do exercise. They exercise. Siera and her mother are exercising transitions. Siera does independent walks around the backyard. I mean, probably they would wish they have such a big yard, but I didn't have a picture of their own backyard, so I got one from the internet. So walking around the backyard, Siera does a lot of exercises to relax the hands. So those exercises are made for her to keep the hands down, because she has the tendency, like many with Rett syndrome, to lift the legs up. So I'm going to show you, this is one of the exercises that Siera is doing. Okay, you see she's walking with the weights on her wrists. And this is one way that you can get Siera's hands down. She's also taking her hands down when it's demanded by her mother. So they're working a lot on relaxing the hands and avoiding a lot of tightness of the hands. Okay, and so they have exercises for the hands, and also they have a treadmill at home. So they're practicing. So in the winter, they can practice on the treadmill. In the summer, they can practice on the bike. So they have really a very rich program. But the thing is that now that they are at lockdown, they actually have, they keep up the programs, because now at lockdown, Siera has one PT session. She has 2 PT sessions a week, one music therapy remote rehabilitation session a week, and one remote rehabilitation session of occupational therapy a week. So at first, I think that we'll go to Siera and Lisa's house, and we're going to see the exercises that Lisa is doing during their physical therapy meeting. Hi.
Hi.
Hi, Lisa. Hi, Siera.
You say hi. We're sitting on the floor. You can already see she's been sitting here for maybe 5 minutes, and you can see she is already leaning to the right to get off that left hip. I'm not sure how much Siera is going to cooperate today, because she's already had an hour of PT with her physical therapist remotely, but we're going to try. We start each session with Siera on the floor. We have her lay down, and she probably will tip her head up and give you dirty looks, but those are usually for physical therapists. The first thing we start with is just trying to relax and to release that left hip. Usually I put the leg out to the side, the left leg, and I'm pulling down on her femur, and she already relaxed. See how she put her head down? She's already relaxed, and it may be because we already had PT today. Typically that takes me a couple of minutes to get her to relax like that. And that's one of, like I said, the first things we do. And then after we have done that, which usually takes longer, we do kind of what you were already saying, we bend up both legs. Again, to stretch out that left hip. We just bring her legs to the left, while at the same time trying to keep her shoulders back and trying to get her to relax. And again, I don't know if you can hear her deep breaths that she's taking when she relaxes into that stretch. We usually hold it for a couple of minutes until she has relaxed. And again, she's pretty stretched out already after an hour work this morning. And then after we do that, we let her bring her legs out. You can sit up. Sit up, Mom. Those are the main things that we do on the floor with her. And then after that, we do some side standing or some side stepping, some backwards walking. We're gonna go up, okay? We don't have a great way of getting up, and I know you're probably gonna yell at me when you see how I get her off the floor. I don't get her off the floor like her therapist does. I just brute strength it up. I know she does the tall kneeling and the proper way with her therapist, but however, I don't do that. We work a lot on the side stepping with Siera. Again, a lot of what we do is just for that left hip, other than our normal activities. You can do that. Stay side. Let's go this side. Stay side. And then we also do a lot of walking backwards with Siera. We'll make her walk backwards to the bathroom when she goes to the restroom. Sometimes even to her bedroom, she'll walk backwards. A lot of times going down the ramp, we'll go backwards because she may freeze up. We work a lot on just having her have a controlled movement to sit down. You can do it. You can do it. And of course, the leg, I don't know if you can even see her anymore. But those are just, the stretching of her hips are our big things that we struggle with. Making sure I'm doing it properly. We do the ball a lot with her. Everything that you've already kind of said. I don't know if there's something else you want me to show.
No, I'm going to, we actually saw what you're doing, and it's a good thing that you already did the physiotherapy PT session in the morning, so all the stretching that takes a long time were actually very short, and we got a glimpse of her PT program and what she's doing. I'm going to show them the video that you sent earlier this week about the music therapy program that she has.
Sit down.
So I want to thank you, Lisa and Siera, for letting you into your house and showing people those exercises that you do. Thank you.
Thank you
very much, and you have an amazing program.
Thank you.
You are the example I was looking for.
Thank you.
Okay, so as I've said before, Siera has a very impressive program. Aside the fact that they're doing all those exercises, they have the treadmill that they walk every day, and they have the bicycle that they ride. So she has those 2 PT sessions a week, and she has music therapy. So I'm going to show you how her music therapy looks like.
Instruments to the guitar. As you can see, Siera's hands have been separated the whole time. She is watching me more than she normally would, just because I'm here. Cindy, is there anything you want to share or add to what's going on here?
The virtual sessions make it more difficult because it's harder for me to follow Siera, because what I love doing is playing back her notes and everything. So that's why, I don't know if it's coming across, I'm being very quiet, but I am trying to follow her notes and everything, and I can get some of them, not as many as when we're face to face, but it's still really working because Siera will keep playing with me, which is awesome.
Okay, thank you.
So you can see here that Siera's phone is showing a musical instrument. Now they're playing a guitar, and the music therapist can actually control what Siera is playing on her phone, and then Siera is playing, the music therapist is playing along with Siera. Okay. The movement of Siera's fingers on the phone is actually what makes the music, the notes. So this is Siera's program, and as you can see, it's very intense and very, very rich. Things that I've suggested in addition to the program, well, actually I suggested the active passive trainer before I knew that they have a treadmill, but still you can use the active passive trainer, the APT. There are a lot of instruments in the that you can buy. Some of them so a lot of companies that sell them. This is this device that you see here. You can operate the hands and the legs as well. So this is very good if you operate the hands, and you actually also have movements of the trunk. And this is something that you can do also with girls who are less active than Siera. Another thing that I suggested to Lisa and Siera is to do hydrotherapy, because the thing that what they're, as Lisa mentioned, most of the exercises are to get Siera to tread her left hip, to actually bear weight on the left side. So actually in the water, there's less weight bearing, and then Siera can walk more symmetrically. Another thing that they can use is something that is called ischial weight-bearing KFO. I know it's very dramatic, okay? But the thing is that the upper part of this thing is actually a seat. So basically, what if they use this kind of orthosis, then this actually means that when Siera is standing and walking, she's actually sitting with her left buttocks on this splint. So this is specifically this specific orthosis is actually used for people who can't bear weight on the hip, and actually they are standing and walking, but when they are doing it, they actually sit on the left buttock with this instrument. Another problem that was mentioned by Lisa is the fact that the phone sometimes moving when Siera is doing her music therapy session. So there's a lot of things that you can buy out there. You can use Velcro, you can use a non-sliding device, you can use a magnet or anything, but just there's a lot of possibilities out there. And what Lisa was mentioning most is those dystonic episodes in the shower. The thing is that when Siera is wearing her SMO, or small, it's a smaller orthosis that holds your foot. Okay, when she's wearing it, she is stable enough so she can put enough weight and doesn't have to work very hard with the muscles around the hip. When they go to the shower, she doesn't have the SMO on. So then she actually has to dynamically control the hip. And this actually probably I think, causes her some pain and therefore she raises, suddenly she might raise the left leg up. Of course, when you're in the shower with soap and water around, standing on one leg is not a very good thing to do. So what I suggested to them is to use this device. This is actually an ankle sprain splint. It's made out of, it's completely out of plastic, so there's no problem wearing it in the shower. And this might hold Siera's leg and give her enough stability so she can actually will not present the dystonia episode that she's showing today in the shower. And we have some time, so I'm going to talk about how to fight hip subluxation in Rett syndrome. And as you know, this is the hip joint, and the normal way is that the femur, the hip bone, is actually inside the acetabulum, the pelvic joint, which is called acetabulum. And sometimes this hip, the femur bone is dislocated, but before it gets dislocated, it is subluxated. So this means actually that the head of the bone is shifting pressure and gradually going out of place. The causes for this hip subluxation, there are a few causes that might cause hip dislocation. First of all, gluteus maximus, this muscle, it's actually our butt. Our butt is a big muscle which is called gluteus maximus. And if the muscle surrounding the hip joint, especially gluteus maximus at the back of the hip, is weak, then actually the hip joint can slide backwards and out of place. Another problem is if we sit all day long and the hip is in a flexion position. Okay, this is another problem. So we have the hip flexed and then weak muscles at the back. And then we have this backward slide of the head of the femur. Another problem is if there is an overactivated hip internal rotators or adductors. So this position, as you can see in this picture here, is a picture of somebody with internal rotation and adduction. And what we want to do is also another cause for hip dislocation is repeated postures of adduction and internal rotation. So W sitting, for instance, is a position of internal rotation and adduction. If the child is sitting always with one leg on top of the other, or if she sits like this, sliding to one side all the time, the same side. So the basic components of the anti-subluxation hip program is, of course, doing the opposite of what I've just suggested and preventing the causes. So one way is to strengthen. One way is to strengthen and shorten gluteus maximus because it's long and weak. We want to maintain hip adductor length. We want to apply inward pressure towards the acetabulum. We want to press the hip bone inside the joint, and we want to prevent long-lasting bad postures. So in order to prevent long-lasting bad postures, we can have, you can see there's a lot of instruments. There's pillows that you can use in bed when you are sitting. There's something that you can wear when you're standing and walking. So there's a lot of instruments. So I'm going to present to you two case studies. One of them is Amit. We actually met Amit in the first session that we have at the beginning of the month. She's 9 years old. Her functional ability is turning from supine to the left, and she has bilateral hip subluxation without pain. And the reason for the subluxation is that she has hypotonia and she doesn't control her body. So like many with Rett syndrome, they try to find muscles that can kind of fixate the body and get some stability in this dyskinetic movement that comes along all the time, because the muscles are not responding to your commands, and then they just twitch all together. So one way of getting everything in order and stopping this constant activation of muscles is to the brain of the girl with Rett syndrome finds some muscles. It's different from girl to girl, but the ones that choose hip adductors are in danger of hip subluxation. So the program of a meet includes maintaining adductor length. This is, for instance, one of the postures. And as you can see, the pillow here is maintaining her leg flexed, and she's in abduction, external rotation position, stretching the adductors. This position is also good in the case of a meet. You also have a danger of kyphosis. So this is extending the back, the hips, and also maintaining shoulder range of motion. As we talked about strengthening the gluteus maximus, so I've built this kind of standing frame. It's a training standing frame. I use it in therapy, and as you can see, it is externally rotated and abducted, and it's also slightly tilted forward. So she's put inside it when she's in lying down position, in supine position, and then she's brought into a standing position. And because those AFOs are forward tilted, she's actually forward tilted, and to prevent herself from falling, she's actually working with those back muscles with the gluteus maximus. In order to prevent continued bad postures, then we use this. So in bed, she has this. This is made out of a flotation device material, and it's cut and put inside her pajama pants. Of course, the pajama pants needs to be tight in a specific manner, so it's easy enough to put inside the pants, but it stays in place. If the pajama pants are too loose, then it goes out of place. In her sitting system, she has this knee separator. So we have a day and night maintaining abduction. And then we have to compress the femoral head towards the acetabulum. So on the left here, you see this is a standing frame which is called Gazelle. I think there's only this one and another one who are built so they can actually put the child in an abducted position when standing. Another way to do it is what I did here in the standing frame. I took a regular standing frame, I added wood here, and which makes this standing frame an abducted external rotation standing frame. So this is how she stands at home. This is a chair that I built for her, and as you can see, because of the straps holding the feet here and those two straps that abduct and the legs, then she's sitting watching television when her legs are external rotation abducted, and because this seat is forward tilted, it's actually making pressure, causing pressure of the femur inside the acetabulum. And this is the results of her subluxation, and you can see we started in February 13 at 35% of the right hip and 24 of the left hip. And as you can see, after a year and a half, we're not getting a lot of. We didn't regress the subluxation a lot, but at least we're in a good direction, because we're actually getting good results. It doesn't get any worse; it actually gets a bit better. So this is the results for Amit. And another child that I want to show you. She's 5 years old, and suddenly, a year and a half ago, she doesn't do any adduction, but she suddenly was found with 70% right hip subluxation without any pain. She can stand. This girl can stand. My sister against the wall. She sits without back support. She sits alone. which actually, this is what I was talking about. She's shortening the iliopsoas. Iliopsoas is the muscle that flexes the hip. So if it's shortened, then your hip is flexed all the time. And this is one of the problems causing hip subluxation. And she's used to leaning against tables. So she's kind of always working forward, leaning forward with the muscles. So abdominal muscles and the hips are, hip flexors are working constantly, causing her to kind of be flexed at the hips. And the main thing that causes this subluxation is the fact that she's doing those bunny hops. As you can see, when you're doing bunny hops, you're actually, the leg is in flexion, adduction, and internal rotation. So as we said, this puts extreme pressure on the hip joint. And actually, this is why she was found on a regular follow-up, orthopedic follow-up, to have this subluxation of the left hip. So as you can see, she's doing the same exercise to maintain hip adductor length. She's maintaining abducted position at night. Again, I'm using a kind of a flotation device to get her abducted at night. She is not allowed anymore to do bunny hops because this is actually what takes her hip out of place. She's encouraged to stand like this instead of leaning forward like she used to do. Now she's mostly standing with the back against the wall. As you can see, the feet are abducted and externally rotated. So she's working with extensors instead of with flexors as she used to do. And I also built this chair for her. So again, the chair is forward tilted. So she's getting pressure on her femur inside the acetabulum. And this is also for her. I've changed her standing frame. She had the standing frame that she got from the Ministry of Health at home, but she didn't use it. So I changed the standing frame, added this board here, wooden board here, and then changed all kinds of things here. So she's standing with abduction, external rotation, and watching television. She's okay with it. And as you can see, she started with 70% subluxation, and now a year and a half afterwards, she's at 25%. So this is a very nice improvement. I mean, the orthopedic surgeons at this point were rushing the parents to do a surgery for the hip, and now they're just saying everything is okay, so just keep doing what you're doing, and we'll keep following up on the hip, but you just keep doing what you're doing. So that's all for today. So I hope that Paige can join us now and sum up this meeting.
Meir, thank you so very much. We always gain so much insight and amazing information from being with you, and we appreciate you being with us. We do have a few questions that have come in through chat. Would you be willing to field a couple of them while we still have a few minutes? Okay. Okay, just a few, and then we'll take most of the things that are coming in through the Facebook comments, and we'll answer them offline. So we did have a question from my mom, which is, what if her daughter is tight? She's not tight in her hips, but she just doesn't want to do the stretches. What kind of relaxation techniques do you have to recommend?
For instance, they can use a jacuzzi if they have. You told me they don't have a lot of jacuzzi in the States, but a warm tub or inside a hot tub, then this is one way of doing it. Another way of doing it is actually use the slings that I suggested at the beginning of this talk, because when you are in the slings, your body feels supported, so you actually feel secure. And when you are secure, then you can start doing very slow movements and get the child to relax, and at the same time you're moving different parts of the body. Hydrotherapy is another option that you can get a lot of movement, because most girls with Rett syndrome like hydrotherapy, and the water is warm and you can get the muscles to relax. Another way is when you're doing all kinds of stretches, is if you put some proprioceptive input on the muscles. So if you put elastic bandage on the muscles, another way is to warm the muscles. So if you have hot packs or all those things that I was showing when we talked about relaxing Keilly's muscles. So all those things that you do, you put when you have a tight neck, then you can put it on the child's muscles, and then again with slow music, slow movement, a lot of pressure, a lot of patience, and then maybe the child will relax. And I think that as Lisa, Siera's mother, also said that despite the fact that Siera is a very active child, woman, it takes a few long minutes until she actually gets loose and relaxes. So this is Rett syndrome. Okay, they are very tight. They are afraid of movement, and the only way to get them untight and moving is to do a lot of movement very slowly, very routinely, so the child knows what's going on and she can relax, and do it in the same way and do it again and again, and explain to her that it's good. So you're actually working cognitively, sensory, and emotionally to get the child to relax.
Yeah. Okay. So thank you very much for that. If their child is not tight yet, because some of our children don't stiffen up, but they don't like stretching programs, do you still think that stretching exercises are important to get them used to it in the event that maybe they progress and become tight in the future?
I think it depends on the child, because if it's I mean, you can get tight because of many things. First of all, if you're not sure about the person moving you, usually the girls know the parents and they know how they are being handled by the parents. So most of the time, they're not so stressed out when the parent is doing the movement. So it depends who is moving you. It depends if you are ready for it. I mean, because they have difficulty in sensory in processing sensory information, then I would actually, they have to be notified ahead. This now we're going to do this and this movement, and then the child is ready. You have to start with slow movement. You have to, so I suggest movement to every girl with Rett syndrome. Of course, it should be according to what she can take. Not enforced, but I think that every girl with Rett syndrome, specifically those who actually show fear of movement, and sometimes they get people around them to avoid movement because they show how much it's not comfortable for them. These are the ones that needs it the most. So I think that movement is something necessary for every girl with Rett syndrome.
Thank you. Another question came in, and it is the parent is asking, what do you recommend for their child who cannot stand or walk on her own? And if you don't mind, I'll go ahead and answer that one for you. I'll refer them back to the previous sessions that we recorded, and those are available on the Facebook feed or on YouTube. Because in our first couple of sessions, Dr. Lotan worked with a couple of kids who are not able to stand or walk on their own, and he gave some great recommendations. So in the interest of time, I invite you to go ahead and look back at those recordings, and then reach out to us on Facebook if you still have some questions for ideas, okay? We have one more question. This comes from a family that I know, and I know their daughter well, and they want to thank you, Dr. Lotan, for the opportunity to ask you a question. Their daughter, Reagan, who is 5 years old, and has Rett syndrome is able to walk, but they hold her each hand on her own to help her remain supported and vertical. And she'll take a few steps, and then after taking a few steps, she stiffens up, plants her feet, and then she'll arch her upper back and tighten her arms. And these episodes last consistently for about 30 seconds before she will loosen up and start walking again. They don't see if this is breath holding or if it's just a muscle arching that she does. So I don't know. But her stride is consistently more side to side than forward. And they're wondering if you have any ideas to help her work through those stiffening episodes.
I've never seen a girl who has those episodes, despite the fact that many parents reported that those stiffening exercises. I think that maybe a treadmill, a very slow treadmill that actually works all the time, will kind of get her into walking for long distances. The fact that she's doing side shifts is actually regular for many with Rett syndrome, but again, it's something I never tried, but it's kind of on my mind for for a long time. You have those it's called ellipse machines. It's like skiing, and the legs are going actually one after the other, and you have the leg support is very long, so actually you can stand two people one behind the other, and if you have the hands of the child with Rett syndrome on the poles, maybe with some kind of elastic bandage or something, and then so you get good movement forward of the legs and together with rotational movements for the trunk. So I think elliptical. Elliptical. It's called elliptical, and it's kind of. So I think this is a very good machine for girls with Rett syndrome, and also the parents are doing very good exercise when they're on this machine. So it's everybody gets a bit of exercise on this machine, and I guess this is kind of something that it will get the girl with Rett syndrome into a more normative way of walking, of movement.
Okay. And I would imagine that possibly hippotherapy, horseback riding, bicycle riding might also get some of that normative movement, rhythmic movement going.
Hippotherapy is actually the horse's pelvis is moving in a normative manner, but the thing is that it just moves you in a normative manner, and the legs are still. They're not moving because you're sitting on a horse, and because of the apraxia, I think that you actually have to practice with girls with Rett syndrome inside the function that you want them to get. So if you want to get normal walking, then hydrotherapy might be a way of doing it. Treadmill, elliptic, all those kind of different ways of walking.
Okay. Well, thank you very much. And I think these are future ideas when people can emerge from home and start to get some of these bigger pieces of equipment. So I think that's it for the questions in the chat for right now. I know that there were some specifically for Ariane and Lisa, and they are gratefully going to go into Facebook and reply about some of the equipment that was shown and some of the music therapy programs. So I think we're ready to bring this to a close. I have some information about our next upcoming sessions. And so I'll go ahead and do that unless you have some closing comments.
No. So thank you everyone for joining us, and see you in 2 weeks' time. And bye, Paige.
Okay. Thanks, Dr. Lotan. We'll talk to you soon. And I think we're going to bring up a slide now that has some future sessions just to get you to mark on your screen. So As I mentioned, we're going to go ahead and answer your comments in the Facebook feed, so check back over the next couple of days. We're hearing great news from around the country that schools and clinics are in communication with families via email and phone calls, doing a lot of Google Hangouts and Zoom sessions. They're willing to arrange for maybe drive-by pickup of some equipment that you've been intrigued by seeing on these sessions and want to try on home. See if they'll loan it out to you and figure out a way to get it to your house. Please share these recordings with your professionals so that while they're at home and they might have a little bit more time on their hands these days, they can take a look at it and be thinking about some modifications to your child's goals for when things return to normal. We want to emphasize that we know you have a lot going on right now and time is wearing on all of us. These at-home activity movement goals are aimed to be as much as you can for your child to be doing independently, to allow you and your family to not wear out your backs and to continue things around the house that you have to get done. We know many are working from home and juggling online learning and other kids, and so we don't want these sessions to be stressful for you, but we want them to provide a lot of ideas for you. We want to thank our sponsors, Acadia Pharmaceuticals, Neuron Pharmaceuticals, and Greenwich Biosciences for their support for our 2020 education programming. But we still need your help to keep these valuable resources flowing to you from rettsyndrome.org. And we also, as you know, have a lot of valuable research to continue to fund for our search for transformative treatments. So if you find this effort valuable and you want to consider giving a gift of any kind, $10, $20, whatever you can make a donation through our Facebook page. You can make a donation on our website, or you can text in a donation. Just text the numbers 41444 and text Rett 2020, all one word, RETT 2020. So if you, thank you, there you go. So text Rett 2020 to 41444 if you'd like. All right, so for the health of our children, we have postponed our in-person June events. The San Diego Rett Getaway, as well as our Rett Ed Day at Kennedy Krieger in Baltimore, Maryland, will be postponed. And we are leaving our events in Portland, Greenville, and Chicago for the fall, still on the calendar, but to be determined. If we can go to the slide that shows the upcoming events, we won't stop with our empowerment activities live and virtually. We'll see you next week, Thursday, April 23rd at 1 p.m. New York time with Dr. Pam Diener. We're going to bring you some OT information and some of the neuroplasticity, wiring, brain anatomy that is enabling a lot of these therapies to be effective with your kids. We think you'll really enjoy this. Note that it will not be on Facebook Live, so please sign up for it on our website. You can go to rettsyndrome.org/COVID-19 resources, or you can go to rettsyndrome.org/families/education, and you can see the sign up for that Rett Ed, or we'll put it in the comments link of our Facebook page. Okay, then, and that session is going to be titled What's Going Right in Her Brain. On Monday, April 27th at 2 p.m. New York time, we'll be back with you on Facebook Live with more communication ideas from Drs. Teresa Bartolotta and Dr. Jill Townend, two authors of the newly published Rett Syndrome Communication Guidelines. On April 30th at 11 a.m. New York, we'll be back with Dr. Lotan to meet live with another adult to demonstrate how they're using their ceiling lift to do some home exercises in bed and that don't require so much work from her parents. So we think that session will be really valuable. That live demonstration will be abbreviated. And what we're going to do then is go into just a live QA session with all of you where you can have a chance to ask Dr. Lotan questions. So go back, watch all of the sessions when you can that we've recorded, try out the techniques that he's recommended, and we'll give you that chance on April 30th to ask him, give feedback, how it's working, what adjustments do you still need to make, and what questions you might have for him. Okay, so Monday, May 4th, we invite you to join us again for some more communication ideas with Drs. Bartolotta and Dr. Townend. So as you can see, we're committed to being with you during this stay-at-home time. We're trying to offer you ideas that are aimed for what you have on hand and give you time to try them, then come back again with us and tell us what's working, what's not, and what new issues have come up at home. If you'll go to the next slide, we have a Survey Monkey up that you can submit questions that you'd like to hear from our speakers, our upcoming speakers, for Dr. Lotan, anything for communication. If you could answer the Survey Monkey in advance, it'll really help our speakers prepare and be ready for you with some images, videos, some things that will help answer those questions. But of course, you can submit them during the live session as well. Also in the Survey Monkey, we give you the opportunity to tell us what other sessions might help you during this time. So we've been really focusing on movement and communication. We think right now those are probably the two biggest things that maybe you're not in the habit of practicing at home and you don't have your typical supports for at home. So we're trying to really bring you some ideas to get you through this time. But if there are some additional issues that you'd like us to talk about, let us know in the survey, okay? So remember, let's go to the next slide, that the newly published Rett syndrome communication guidelines are available. The print version and the ebook version are orderable online. Section 4, we've downloaded and made available for free that you can put into practice right now because shipping and fulfillment is taking a little bit longer. The ebook, it's 116 pages. So ebook is not as easy as print to go through, but you can order that as well. And that might really help for our international families while we're working out the shipping part, and some of your local associations are working through translations. So again, you can find all of those resources at rettsyndrome.org/COVID-19-resources. So progress takes time. We know it's possible with our kids, so be patient and don't give up. Our children have a lot they can do and communicate, and we know these resources will help you guide in this process. So share them with your resources, although they can't be with you in person. Many of them are staying in touch, and they're happy to be getting this information. We've been sharing it with our own child's educators and therapists, and they've been coming up with some great ideas for Katie while we're at home. So let's wrap it up for the day. I want to thank Dr. Lotan. I want to really thank Ariane and Keilly, and I want to thank Lisa and Siera for being so helpful in demonstrating new activities for us today. Thanks for welcoming us into your home. We know it's a big ask to be camera ready at this time, but you did a great job and you helped so many. We hope you also learned some things from Dr. Lotan that will help you at your home. We wish you good luck. And Dr. Lotan, have a good evening. Thank you. Be well, protect your back, and we'll talk again with you soon. Thanks.